Hello, everyone, and welcome to the SMA EMR team's Digital Health Checkup webinar series. Once again, today's topic is the Enhanced Use Program, and today we're going to be talking about what the program is, where it comes from, and how you can be involved in the program, and what it means for you. So my name is Andrew Strang. I'm a team lead with the SMA EMR program. Several of my colleagues are here today to help facilitate the discussion, and we also have a very special guest speaker, Dr. Mandy Nell. Dr. Nell was part of the limited launch of the Enhanced Use Program, and she has a lot of great experience to share with you. Dr. Nell is a family physician who's been practicing in the Esterhazy area for the last 15 years, and she has a lot to say about the benefits of the program to her, and hopefully it'll be an enlightening conversation. So we'll just get started with talking a little bit about what the program is. The Enhanced Use Program came about because EMR adoption goals within the province were met. We've reached I think 87% adoption now in the province. So as a team, we came to the conclusion that we needed to expand more into the enhancement of use of the people who had adopted, creating what we call enhanced use because it's in many senses optimizing the way that you use your EMR and becoming more familiar and spending less time in the EMR and less time on tasks so you can have more time with patients, essentially is the idea. And this was something that we developed in response to physician feedback, in many ways, physicians' frustrations with things that they were experiencing with the EMR that they found difficult to navigate. So we'll talk a little bit about what the Enhanced Use Program is. And I'm going to hand it off to Erin, who's another team lead from the EMR team, and she's going to talk a little bit about what the program involves.
Thank you, Andrew. Well, what exactly is this? Well, as Andrew mentioned, to be honest, it's kind of been a natural evolution of our program. When we met our adoption rate several years ago, the practice advisors found that we were really spending a lot of time working with physicians and answering queries about, kind of quick wins and what their frustrations were. So we kind of took away all that feedback and decided that maybe instead of focusing so much on the adoption portion of it, we should change our tact a little bit. And we developed a portfolio of services. So what some of the things that would include, I think some of you are familiar with or have utilized already the self-editing dictation software, Fluency Direct. We've been providing that to physicians. Andrew is leading up our peer program. So we've gotten a group of peers together, physicians as well as office staff, that can have more detailed workflow kind of discussions with physicians and clinics with respect to their EMR, making it work a little bit better for them. We've kind of, we've always done, but we're doing even more so, a lot of one-on-one with practice advisors, so different one-on-one training sessions and workflow discussions, things of that nature. And when we formalized all of this and came up with this kind of a journey that we put together for physicians, it's really starting with a baseline assessment of what the current state of physicians' use of the EMR. And the idea behind that was, instead of us meeting with you and discussing the pebble in your shoe of the moment, we were looking at taking more of a holistic look at your clinic as a whole and your utilization of the EMRs, and figuring out where exactly you are, where your strengths are, and what are some of those gaps that you were looking to fill. So it may result in some different training from practice advisors, utilization of one of the peers. It could be some software suggestions, things of that nature. And like I said, we've kind of formalized it into a whole process, starting with that assessment, where we can support you along the way.
So I'll talk a little bit about what to expect when you actually start the program. So we have a registration phase, basically, where you either express interest to your practice advisor, or you reach out to the EMR general email address, or you contact our team, essentially, and let them know that you're interested. we'll register you for the EMR progress assessment. Once you're registered, we'll get you signed up for the progress assessment. We'll give you access to the online portal where you'll do the self-assessment, and as part of that, you'll do an interview with your practice advisor. And the time that it takes to go from registering for the EPA to actually doing the EMR progress assessment will vary. We've actually had quite a lot of response to this program. So at the moment, it's within a week. Generally, you'll hear back from us about when we will be able to set up your EMR progress assessment and the interview. Going through the assessment and interview process takes about 90 minutes. And once you're finished with that, then you'll move on to the next phase. And the next phase is where we create an action plan for you. So your practice advisor will create an enhanced use action plan based on your assessment and your interview. And then they'll deliver that to you and give you an overview of what was uncovered in that assessment. And you'll agree on how you're going to achieve these action plan goals. And before I move on to the next phase, maybe this would be a good place to stop and ask Dr. Nell a couple questions about her experience going through this process. So, Dr. Nell, when you went through the self-assessment and interview phase, how did that affect your outlook on your workflow goals?
Sorry about that. Good morning. With the assessment of my EMR use, I moved from literally thinking of the EMR as just a way to file documents and how to keep records and notes of my encounters with my patients to actually utilizing every small part of it in improving my workflow, how I book appointments, how I make billing more efficient for every little sub procedure that we're doing, so that a lot of the things is automatic. How we recall patients, it really made me realize that this is not just a record keeping entity. It is a wonderful tool that we're sorely underutilizing. And since then, and every improvement that I've made, now it's just so natural. I can't even remember all of the little minor changes that I made if I have to explain it to someone, which is sometimes a bit frustrating when I'm trying to teach my new colleagues how to use the system. It's like, oh yes, this is what we do automatically. The EPA opened up this whole EMR for me and helped me work through every little thing. And it didn't take time, it wasn't work, because it helped you work better and more efficiently. So I really love this program, or loved it, and I highly recommend it.
So Andrew, I'm just going to ask Dr. Nell, so when you're saying it was not easy, but it opened up ideas for yourself. So when we look at the time commitment, and I know you are an ongoing learner, so you're always gung-ho and into learning, but when we look at when we went from the assessment, like you completing the assessment and the interview, went through the different stages, and then looking at your time commitment, and I know you're saying it wasn't a lot, but when I went back and looked, you and I, and actually Nicole was involved as well, basically 4 times.
Excuse me, Charlene, you're cutting out really bad.
Okay, do we have everybody mute? Yeah, okay, I'll try again here. Is that any better?
I think so. Keep going. Sorry.
Okay. No, that's good though. So we met 4 times, and initially we were able to meet in person, which was nice, and then we went virtually. So obviously, there's that time commitment there that you put in, and the interaction and going back and forth. I'm quite sure that you did some work in behind the scenes as well. Can you just comment on that?
Yeah, so the EPA made me realize that there is actually some specific areas that I want to improve and could improve in my EMR. That was the important thing. I realized that there was little things that could be done to improve how I'm currently doing things. So when we set up our goals, and because I knew that there was something that could be improved, I would try and go and get some information from that. And then specifically with the session that we had to address the first goal, during that session, Charlene showed me this is the way that we do it. So we already immediately implemented it. And then in between the two sessions, I would use whatever new system we had implemented. So it really didn't feel like work because it just flew. For instance, the one thing that I found was an eye-opener. We do urinalysis on a lot of our patients in our clinics. And there is a small extra sub-procedure code that we can do. And if a patient comes in for with a questionable UTI, my staff would book that appointment as query UTI, and they know that they do a urinalysis before. So automatically what we did is we tagged that procedure booking. We already have a mini code attached to it, so that it automatically bills that, whether you remember to add the subcode or let your billing clerk know, it's already attached to that visit automatically. So that little bit of money that is left on the floor, you automatically get without having to remember to add in that code or that sub procedure. So that was something when we realized that's something that we missed. We immediately implemented it. We made the changes in our EMR, and it just worked. So, and that's what happens with every visit with Charlene. We figured out what is my goal for the next time. We address the goal for today. We implement it, I use it, and it just flows. So that's what I mean by it didn't take work. And the sessions with Charlene, we all love that one-on-one with our EMR providers to really get that nitty-gritty. Okay, this is where I'm stuck. How do you do this? And that one-on-one is just invaluable. It helps, it shows me how to do a specific action or teaches me a new shortcut. Then it's up to me. I have to actually practice that shortcut, but every time, so with me, every time that I figured out this is something great, this is something that I will use, I make a point of using it so that I don't forget it, and now it's just second nature. Hopefully that answers how I did it.
Thank you. Thank you.
Yeah, and as Dr. Nell alluded to, so the kind of the phase that that you'll go through after the action plan is delivered to you, and you've had the discussion about your goals. You'll go through that whole collaboration with your practice advisor. That your practice advisor will be able to facilitate whether you would like to have Fluency Direct installed on your computer, whether there's other enhancements you need for your EMR, and you'll collaborate on how to achieve your goals and what training you need, what kind of coaching you need, whether that involves coaching from a peer or if you need to get training from the vendor. All of that stuff is available. So one of the things that I think we could maybe ask you, Dr. Nell, about your experience was where did you find it most challenging? What were the areas that you sort of felt like you had some challenge to actually achieve what you were after?
I realized that I wanted to be proactive with my patients. So the first couple of steps was literally putting in data, or my first goals was, how do I bill a bit more efficient? How do we schedule time better? Those were really actually easy stuff, but they are important because those are seconds and minutes that improve your patient flow, so you have more time. My final goal was actually using my EMR in a proactive way in preventative medicine. So I'm coming up with lists on who is all of my patients with diabetes, coronary artery disease, with a 4CD chronic disease diagnoses. Seeing how often am I seeing them? Are they going for the lab work? How can I get a list of patients? And then the second part is, out of that list, who's overdue for going for blood work, who is out of target for their HbA1cs, for instance, and really whittling it down, who is the patients that I really need to try and work on or spend more time with. And then I'm getting proactive lists. Pap smears, for instance, we're trying to get patients to come in more regularly, although that's a process that's run by the government with the letters, but I still find that patients don't come in for their pap test. So that's an easy, my young patients, when was it done? How can I recall them automatically to come in? That was the biggest challenging part for me. And that is that's when you have to learn how to do queries. And that took a little bit harder work, I want to say, but it was still fun. And when I was able to actually do it, very rewarding. And I've also just still scratched the top of what I can do with building queries. I'm still working on how to get better lists to be proactive with my patients.
Well, Andrew, I'm just going to interject. So one of the things that was really came about with the interview and with the assessment with Dr. Nell is she is very good at and very aware of data quality. So we all know garbage in, garbage out. And that's something that Dr. Nell really talks about and is passionate about. When new physicians are getting started on the EMR, it would be so good to have something where they're kind of guided along in that knowledge of, you know, you're entering, make it the most valuable that you can in entering it so that you will be able to utilize that data after. So in some assessments with physicians, there may have to be, and we've seen this, is that there may have to be some data cleanup, or there may has to be not a training, but a real thoughtful process of consistency of what you're entering, naming it the same thing all the time. And then, Dr. Nell, I don't know, but we talked about this in talking to your colleagues about that. Can you just comment a little bit on that?
Yes, that's one thing that I had realized when I wanted to mine the data in the EMR. It's very important that the data is standard. Now, a practical example is we all use our chronic disease management forms, and there's a place that it can pre-populate whether a patient smokes or is an ex-smoker. If you put it into your EMR correctly and in a standardized ways, that can automatically be pulled into the form instead of you having to go onto that box and click it all the time, what the patient's smoking status is. So that's where it's very important that you have clinic-wise, you all agree on this is how we enter it. So if I'm saying my patient is a smoker, they're actively quitting, they're not interested, or they're considering it, whatever those couple of things is, this is the way that we enter the data under the social history. Same with alcohol use. Same with marijuana use, my medical history, surgical history. This is the way that we put it in so that when we are actually trying to mine some information on family histories, how do we get the information out there? And that is something that I worked with my clinic, the colleagues in my clinic to standardize. I drew up, this is the way that we're going to put in surgical histories, medication histories, and so forth. And that's where the data mining becomes very useful, but only if you have standardized input.
Thank you. And that's, again, looking at, you know, your goals and what was set up and the things you wanted to do, and really what we call the journey of going through this and achieving your goals. At the beginning, there might have to be more pre-work done just in that kind of thing, whether it be the data, whether it be some cleanup, entering in, you know, those in the lifestyle history, all that kind of thing. So you had already done some steps towards that, which then to achieve your goal of those queries, and that made it, you know, not easy, but easier than if you had not been doing that at all. So just to recognize that every physician and every interview and assessment is different, because you all work differently and do things differently. Andrew, I don't know if you want to add anything there, or Dr. Nell?
Yeah, there's. I think it actually speaks to you know, the fact that this program is suited to a wide range of levels of experience in the EMR. Whether you're just sort of getting started with using a Cure or Mid-Access, or you have very refined goals for the kinds of things that you want to achieve in terms of data input or speed or practicality. There's all kinds of areas of improvement that we can focus on, from high level refinements to more basic things. And generally, what we'll go through at the end of the process is that we'll do a self-assessment again. And actually, that's I'll talk a little bit more later about the incentives available for this program. But as part of the incentives, you're actually required to go through a self-assessment again at the end of your process, where you've gone through and you've achieved your goals, to just reassess where you're at and what's and where you'd like to go next as well. So if you'd like to do another enhanced use action plan, if you'd like to go through another cycle, you're free to do that as often as you like in order to achieve all the goals that you're after. And of course, as you go through the program, it's likely that you'll discover more things that you want to achieve, and there'll be more things that that you realize that you can do. And actually, that's maybe something I can ask you, Dr. Nels, if you were to go through the process again, what do you think your goals would look like? Do you think there would be things that you hadn't realized the first time that you'd want to go through?
Yes, I think mainly what I want to do now is more focus on the preventative part of it, and really building more queries, better queries. Though I don't think I need a lot more training. The idea would just be, what I liked about this whole program is it sets goals. Where we are so bogged down with stuff and daily clinical work, and there's lots of stuff. I have a whole list of stuff that I'd like to do, processes that I'd like to improve. And with this process, you have a goal, and I know I've got a meeting coming up, which helps motivate me to get some of the work done. When we have our meeting, I feel like I've accomplished something. So that was the other part that I really liked about it. And it's not that you have to do everything in one day. And definitely with an EMR, it doesn't work that way, because you want to learn processes that makes it second nature. And you don't learn something new in one day. And you don't use something new by just using it once. You have to implement it into your workflow regularly. But yes, that would be just having that goals towards, okay, I want to get better recalls for my diabetes patients and build in a system. Because that's an ongoing thing. What is a better system now? I had started a program that I was starting to fine tune, and then COVID happened and everything was stopped. So now I have to revisit how exactly are we going to do that. So that would be my next goals, as well as more utilizing Fluency Direct more fully, because that I really know I haven't scratched the surface of, and I'm not using it to its full potential yet.
So I noticed there was a question in the chat. One of the concerns on queries, the question is, one of the concerns on queries is the inability to search for data within encounter notes. Do we still rely on the medical bands for the queries? Does anybody want to field that question?
Sure, I can respond to that. So you can run queries on different fields within a Curo, specifically demographics, the medical history band, your lab section, but you are restricted. You can't run a query on data that's saved in an encounter note. Does that answer your question, Dr. Pillay? There are some limitations with respect to queries. We do have some information and resources available to us to do advanced queries. So if that would be something that you'd be interested in, we can certainly take that up when we talk more about your assessment. Great, thank you.
I think I'll I'll move on at the moment to talking a little bit about the incentives available for this program. So once you've completed the interview, the self-assessment, and you received your action plan from your practice advisor, and you've sort of sat down with them and had the discussion about how to achieve your goals, there's an immediate $500 incentive available to everyone who achieves that. Once you actually complete all of your action plan goals, you go through the reassessment and you answer a couple of feedback questions that we'll have for you. At the end of that process, there's another $1,500 incentive available. And then in addition to that, there's $1,000 per physician that will be available if you have items in your action plan that involve vendor services like training, software, things that are specific to training and software that within your EMR that might require an expense, say going to the vendor for vendor training, installing Medio, for example, in Accuro. Those kinds of things would be covered, and you would just have to submit your invoices afterward to take advantage of that incentive. So I'm just going to mention that in order to start this program, you just have to contact your practice advisor or the EMR program. And you can find out a lot more about the program as well by going to the EMR website, which is listed on this page. We have a section on our website that is dedicated to enhanced use and improving your EMR. So please feel free to check that out. I just noticed that there was another question in the chat. The question is, when is the enhancement program available by? Well, the enhancement program is available now. We have actually had a lot of response to this program, and we're going to, every time that someone gets in touch about being part of this program, we're going to basically set some expectations in terms of the timeline, because in general we are going to get back to you within the week that you inquire to set up your progress assessment and your interview. But it will really depend on volume, how quickly we'll be able to respond to all the requests. But at the moment, we'll definitely be getting back to you within the week of your request to set up your timeline. I think there was another question. Is there a limit to the number of physicians that can join the program? There's no limit to the number of physicians that can join the program. Again, it really just depends on how quickly we get to you and how quickly we get through your action plan. Really depends on the volume of physicians that we have interested, because we have 7 practice advisors and of course hundreds and hundreds of physicians in the province that we serve. I should mention that every physician will do their assessment independently. It's very particular to your practice. So the fact that it is a one-on-one process means that that the more physicians we have interested, of course, the longer it will take for us to get through everyone's action plan and program. But in terms of setting your timeline, figuring out your schedule, and making the program work for you, we'll be in touch with you pretty much right away once you get in touch with us. Next question in the chat is wanting to join in 2022, wondering if it will still be available in 2022. As far as we know, we're assuming that we will get the funding renewed for 2022 for this program for the incentives. The fact of the matter is that even if we don't have the incentives in 2022, the program will very likely still be available. It's I think there's a lot of value in this program, and it's our main focus as the EMR team right now in terms of getting physicians into a position where they're able to use their EMRs more efficiently. So our objective right now is to keep this program going indefinitely. Are there any? Go ahead, Dr.
Sorry, I just wanted to quickly say that I really encourage this program, whether there's a financial incentive or not, because it improved my satisfaction with using the EMR so much. I have very few frustrations. The frustrations is just me trying to get every little drop out of it and making better queries. that's where I'm working on at the moment. Billing more efficiently, picking up those little bits of money that I know that I always kept on the floor and that I keep forgetting to tell my billing clerk that, okay, remember I did that little small procedure. It's those small little things that has made such a huge difference to better income, better patient flow. This program is really worth it, and it helps you feel more satisfied with your electronic medical record.
Thanks, Dr. Nell.
Thank you, Dr. Nell. I think one of the big things on the whole enhanced use optimization is we heard, and one of the reasons why the team and why this whole program came about is that, yes, you have an EMR, but physicians were saying that instead of the EMR working for them, it seemed like they were putting all of the work in the EMR and not getting out that benefit of what they felt they needed. So the whole, tagline of get the EMR working for you, where physicians say, I'm not a data entry person, I'm medical, I want more time with my patients. And from the physicians and Dr. Nell attesting that this, if that's your goal, those little things can give you more time with your patients and less time in inputting things. You may have to initially do some more input than what you're doing before, but you're setting up that base to move forward, which ultimately, again, is allowing you to spend that more time with patients if that's one of your items that you're looking for.
There's another question in the chat. Can we incorporate our MOAs as part of the learning process as they enter data when patients are referred? That's a good question. We've kind of structured it around the notion of having the physician be the principal point of contact, but it really depends on how your MOA is involved in your practice, and it wouldn't be out of the question, I think, to have an MOA involved in sort of collaboration sessions if that were suited to your practice. Dr. Nell, were you going to say something about that?
Yes, I just wanted to comment. So, for instance, the billing part of it, when I realized that, oh, we can make this these automatic little billing cheat sheets attached to a specific booked appointment reason, that part I went and I sat with my billing clerk to figure out, okay, which appointments is the little things that there's extra procedures, and we tagged it to that. So that part I worked with her. When there was some improvement that we could do with how we book and the patient flow, that part I worked with the rest of my staff in front to make them understand that when we do this, you guys have to make sure that you do that. So automatically, some of the processes flew. So yes, I didn't specifically get them to sit in on the sessions, but everything that I learned, I could take to them and they could dig in deeper to whatever part of was part of their portfolio.
Thanks, Dr. Nell. Were there any other questions that anyone had? This might be a good point to just open it up to general questions. Was there anything else about your experience that you were that you wanted to mention, Dr. Nell? You covered quite a bit of ground here, but we're coming near the end of our time. If there was anything else that you thought was important to mention, or if anybody has any other specific questions, please jump in.
I think it's maybe worth mentioning that I did do some training through Acuro, specifically asking them to set up some sessions because I wanted to get more information about something. I have to say that I did not find it quite as useful as my interactions with Charlene. It was very specific with her, what we wanted, and if I did have a specific concern and we couldn't figure it out, she would go and they would go and figure out how to do it and then get back to me. Not that I'm saying don't use the training sessions from Akiro. I just wanted to reiterate that the program that the SMA have is quite robust and was able to fulfill all of my issues and what I had queries on about my EMR.
I'll just maybe go ahead, Charlene.
I was just going to say thanks, Dr. Nell. I think the biggest thing there is when we still going back to that initial assessment and the interview is collaborating with each other and really defining what your goals are, and not to say that they might, I mean, they might change as well. So we come back to you and present what the action plan is, but very much you're involved with saying, oh, actually, or deciding which one is higher priority. You know, I thought I wanted to work on documents or whatever, but now it's really preventative. So can we focus on that first? And so truly, it's your action plan. It's physicians' input into it that drives it all.
For instance, in my clinic, my action plan would have been completely different than my colleagues, where I was more looking at using my EMR not just for my own record keeping, but as a clinic management tool to make flow more efficient for the whole clinic, not just for me personally. My colleagues are more interested in what is their own personal input. They're also more, I'm going to say, younger or less time on the EMR than I have. So that sounds so bad. Anyway, the goals are completely different, and that's what's great about this. It is what you want out of it. It is not this perfect plan, it's what makes it perfect for you.
Just to tag on to that, just briefly, is in looking at some of the assessment questions, it really does look at that overall. Do you want to run reports? Do you want to know what the clinic is doing, or what the what types of patients you have? And as Dr. Nell said, she, as I always call her, the lead physician there, truly is looking at the overall clinic, the overall use of the EMR, and where, we mentioned earlier that it's like that data quality, and that you're utilizing the same ICD-9 codes for the same type of, not all over the place. And that takes discussion, and Dr. Nell will say that takes leadership on your part that you do. And that's, I mean, I think you have a very well-run clinic. You're always looking to improve, and truly that's from you and the other physicians there and your support staff in trying to make it the best that it is. And that's utilizing the tools, and the EMR truly is a tool. And you are, just, that's the whole idea, is to make that tool work for you.
So I'll maybe just mention that this webinar will be available as a recording on our website. If you just go to the resources page of our website, you'll find it. It'll be posted in a couple of days. So if you have anyone else you'd like to share this this information with, you can just let them know that it will be there. I didn't have any other specific questions to go through with Dr. Nell, and that was kind of the end of the content that we wanted to share. So if anybody has any last questions, please go ahead. I'll just give you a second to think about it if you have anything else you'd like to ask.
I was just wondering, Dr. Nell, if you had used the Dictation software in your clinic as well, and how you found that.
Yes, we've got the Dictation software, and I find it very useful. I do have to comment, I'm a very fast typer. So in my patient encounters, most often I do type most of my notes while I'm in the encounter. And then afterwards, I would just dictate a little bit of fill-in, for instance. The one place where I use the dictation all the time is when I'm dictating a referral letter. But because that's not something that I've already started doing during an encounter. That's something that I do separately. I still need to work on the dictation system. I know that I'm underutilizing it, and I know that it can be a much more useful tool for me. My colleagues use it in everything that they're doing because they don't type as fast as I do, which is great. That's the whole idea behind it. It helps their document keeping significantly. I do want to add with the dictation system, where all of us in our clinic have different accents. And that's what's great about this program. It learns your accent, and it is not a problem. I have had my new colleagues that's concerned that they won't, the system won't understand them. That's not a problem. It learns your accent. I really don't have a lot of words except for Nell and now, but that's something that we're working on.
Thanks, Dr. Nell.
Were there any other questions anyone had? If not, I think we'll wrap up here. Thanks everybody for coming, and thank you very much, Dr. Nell, for being part of this. I think it was really great to have you here and to be able to refer back to your experiences. I just want to encourage everybody to at least get in touch if you're interested in the program, and we can go from there. So thank everybody for showing up. Thanks to my team. Thank you, Dr. Nell, and hope everybody has a good day.